Hi Warriors! So Unit 9, Lesson 8, we're going to transition, make a pivot over to therapy. So what do you know about psychotherapy? Do you see that portrayed in movies or television shows? I mean, there's a lot of TV shows that come to mind when it comes to the disorder side of things, but what do you know about therapy? How do we treat these disorders? Before we finish, you should know a bit more about the purposes and some of the tactics. So, methods of therapy, we're going to talk about effective strategies for treating these disorders and various perspectives. With methods of therapy, then, what sorts of therapy are we talking about? Well, it has advanced over the years. So some pretty dastardly tactics that we used to use 200, 300 years ago. They're on the left-hand side where you got the guy sitting in a swing. That was a technique that spun that man in circles so that he could be cured of his depression. Now, it would twirl him around in a circle. I don't know what that would do other than make a person dizzy. But a cure for depression. The one in the middle, that guy who's looking at his 3D virtual reality, not really true. This was developed by an American doctor named Benjamin Rush, who was alive during the American Revolution years. And that was supposed to calm somebody down, treat them to be calm. You have the little straitjacket there on the right, and then that bottom kind of crib looking thing, I think it looks a little bit more like a casket, is another thing that's supposed to calm down the violent person. So as you can see, these tactics are kind of severe and drastically outdated. Thank goodness we don't do some of these things anymore. So what do? We practice psychotherapy. One method of therapy is called psychotherapy, and it is psychology, behavior, and therapy. Talking. So psychotherapy is verbal interactions. It is talk therapy between a trained professional and a person that is meant to treat that psychological disorder. So when I've been discussing with you throughout, if you see the therapist and they don't have the DSM-5, these are the people who have the DSM-5 in their office. I've seen counselors before. I've seen therapists before. Awesome. The great thing about seeing a therapist is that it's somebody who is on your side, and they're going to be always on your side because, of course, you're paying them to be on your side, but they're also going to say, hey, wait a minute, this is a problem, and redirect us, help us through the problems. The biomedical approach to therapy involves use of drugs and other medical procedures to treat psychological disorders. So it might be a combination of talk therapy and biomedical therapy that a person is subjected to. What are the goals of psychotherapy? So when you see the therapist, what are they trying to help you do? Well, one of four things. Give clients new expectations on improvement. So if you haven't been getting any better, let's find a way to make you better, to help you get better. Offer new perspectives or insight on their experiences. This makes me think of anxiety disorders, like being aware of the disorder and then deciding what you're going to do about it. Trusting relationship with a client, and help client with alternative behaviors. So let's develop new strategies, since these other strategies don't seem to be working for you. Might be the goal of a therapist. Now look, these are just like random book definitions of the goals of psychotherapy. But you think about it, right? What's going to drive a person to go see a therapist? Maybe a breakup, a divorce, a loss of a job, to failure to deal with stressors. You know, when we have the crossover from stressor to anxiety, that's when we see therapists. Look, I went through a big life change, and that's why I saw therapists. There's been a couple times where I've seen therapists. I had seen one most recently in 2016, and she was wonderful. And then I saw her again in 2018, maybe. I don't know, just to kind of recap with everything. And like I said, it was somebody who was on my side, who, like, I could say anything to. I totally trusted her. And then she could give me opinion and feedback about, well, this is what you're doing well. These are things that aren't working so well. Let's try to put more of our focus on the things going well. Kinds of therapy really depend upon your approach, your perspective about behavior. So there are different options, and we've been throwing these at you throughout the coverage of disorders. So you have your psychoanalytic humanist, which also is known as person-centered therapy, cognitive approach, and behavior therapy. So if you remember that psychoanalytic is Sigmund Freud, unconscious motives, humanists are your Maslow's hierarchy, pyramid of needs, and another guy named Carl Rogers, which you'll be learning about. Cognition is thinking, and behavior is more along the lines of operant conditioning and social learning. Not social learning. Ways that you can handle therapy is individual versus group therapy. Now, the individual therapy, of course, is you're going to see that therapist one-on-one. So on the left-hand side of this graphic, you've got more personal attention, and you may not want to share all your dirty laundry with other people. So it is individualized when you see a therapist on your own, of course. However, if you do group therapy, then you share your problems with people maybe who've been through the same thing. And that's one of the beauties of like a 12-step program like Alcoholics Anonymous. You go in the room, there's a room full of people who have the same sorts of insights about behaviors. They've been where you are. They like maybe they got arrested for DUI just like you did. I don't know. Members can gain insights from other members. They can practice coping skills with others, maybe walk through, this is what's going to happen at Christmas, and I know you're not drinking, so you better be prepared for that. And members see success of others, and that gives other people hope. So group therapy, like a 12-step program, Narcotics Anonymous, there's anonymous everything, Sex Anonymous, Narcotics Anonymous. Anyway, individual is good. One-on-one, of course, is good. But it can be more expensive. Group therapy, 12-step programs are free. You just look them up online and you go. You can even do Zoom meetings now. So advantages to all.